Welcome. My name is Allison Douglas. I'm a BSN to DNP student at Jacksonville State University, and I'm going to discuss weighty considerations in the obesity epidemic and give examples of community-based primary prevention programs for overweight, obese patients. This presentation will cover 6 main topics: an introduction, target population health risks and needs, interdisciplinary plan, leadership competencies, evaluation of interventions, and summary. Let's start with the introduction of obesity. Obesity is defined as weight that is higher than what is considered normal or healthy for a given height. Body mass index, or BMI, is used as a screening tool to determine overweight or obesity. At an individual level, BMI calculations can be a useful screening tool. However, note that it is not diagnostic of body fatness or the health of an individual. A trained healthcare professional should perform appropriate health assessments in order to evaluate individuals' health status and risk. BMI does not measure body fat directly, but appears to be strongly correlated with various adverse health outcomes, which will be covered in coming slides. Obesity is a complex health issue, especially in the U.S. It most often results from a combination of causes contributing factors, including factors such as behavior and genetics, in addition to societal factors including foods consumed, physical activity, environment, education skill level, and food marketing and production. Obesity is a serious concern because it's associated with poor mental health outcomes, reduced quality of life, and is becoming a leading cause of death in the U.S. and worldwide. Having a healthy diet pattern and regular physical activity is also important for long-term health benefits and prevention of chronic diseases. Foregoing quick and easy meals and snacks, such as fried food and highly processed sugar and salts, and choosing better foods like whole grains, fresh fruits and vegetables, lean proteins, and low-fat dairy products can enable patients to lose weight necessary for long-term health benefits. Regular exercise also aids in the reduction of weight loss. The CDC recommends that adults perform 150 minutes of moderate exercise, 75 minutes of vigorous exercise, and 2 days of strength training weekly. Education of successful weight loss involves an understanding that in order to lose weight, the body needs to be in a state of caloric deficit, meaning that individuals need to burn more calories than they're eating. Patients who are overweight, obese, compared to those with a healthy weight are at an increased risk for many serious diseases and health conditions. The following slides list some of these conditions, the most prevalent being hypertension, dyslipidemia, diabetes, heart disease, stroke, cancers, and mental illness. The CDC reviews economic and societal consequences to obesity and reports that in 2008, healthcare costs were estimated to be $147 billion. Medical costs associated with obesity can be direct or indirect. The stateofobesity.org states that obesity is one of the biggest drivers of preventable chronic diseases and healthcare costs in the United States. Currently, estimates for these costs are around $210 billion per year. Obesity-associated jobs, absenteeism, cost approximately $4.3 billion annually, with employers paying $506 per obese worker per year. The prevalence of obesity is serious and is becoming more and more common between children throughout adulthood. By 2016, more than 1/3 of adults in the U.S. are considered to be obese. Medical costs of an obese individual was that double a person of normal weight. This slide shows prevalence of self-reported obesity among U.S. adults by state and territory. No state had a prevalence of obesity less than 20%, which would be in the light green color. The 7 darkest burgundy colored states, Alabama, Arkansas, Iowa, Louisiana, Mississippi, Oklahoma, and West Virginia, had a prevalence of obesity of 35% or greater. This table shows the estimated percentage of U.S. adults that are overweight by sex. This data is from 2013 to 14. More than 2 in 3 adults were considered to be overweight or have obesity, and about 1 in 13 adults were considered to have extreme obesity. Note that obesity and extreme obesity was higher in women than men in both categories. These 2 figures show trends in overweight and obesity among adults and youth in the U.S. The figure on the left shows obesity trends among children and adults from the 1960s to 2014. As you can see, there's been a significant climb in obesity in children and adolescents in those years. The figure on the right shows obesity trends among adults from the 1960s to 2014. And as you can see, overweight men and women have remained about the same. That's the dark green line and the kind of grayish line. But obesity and extreme obesity in both sexes has steadily increased over the years, which is represented. Moving on to target population health risk and needs, let's take a closer look at obesity at the state and even county level. This figure discusses the state of obesity in the state of Georgia. Georgia has the 24th highest adult obesity rate in the nation. Georgia's adult obesity rate is currently 31.6. In 1990, it was 10.1, so there's been a significant climb in that. The following slide discusses data from the Floyd Community Health Needs Assessment from 2011. It includes 3 counties, Chattooga, Floyd, and Polk. Chattooga County was in the 26th percentile for obesity, comparatively to the state, which was 29%. The target population to be discussed will be obesity in adults ages 26 to 64 residing in Chattooga County, Georgia. Chattooga County ranks 53rd out of 159 counties as far as health goes in the state of Georgia. This slide lists some demographics, mortality, morbidity, and health behaviors. Note that Chattooga County death rate is 3 times higher than the national target, and obesity is listed under health behaviors as a major concern. As you can see, under lifestyle issues of the community, identified obesity along with tobacco use, physical inactivity, both of which can be contributors to obesity. Health insurance also appears to be an issue in Chattooga County, as citizens feel like health care is not easily accessible for various reasons. This figure shows obesity by county. Chattooga County is in the northern west corner, and it's about 3rd from the top, and you can see it's a moderately darker blue color, which represents a higher percentage of adults that report a BMI of 30 or more. Let's discuss obesity prevention. So we know that there are 3 levels of prevention: primary prevention, secondary prevention, and tertiary. The primary portion is all about prevention and trying to figure out whether or not somebody has a disease prior to the development of that disease. The secondary prevention is all about screening, early detection, and being able to catch it so that you can slow it or cure the disease before it develops any further. Tertiary prevention is about treatment. Patients already have the disease, and so now they're trying to treat it to prevent disability and restore function. Primary prevention was selected and was felt the best course of action to improve trends of obesity. The first prevention example is in technology-supported media. This preventative approach uses new technology linked with devices to track and encourage weight loss. Such technologies may include computers, pedometers, and mobile apps, among others. A spotlight example of the technology-supported media is the Active Track Fitbit program, which was conducted at IBM and was assisted and designed by the Community Preventative Services Task Force. Employers at IBM were given a Fitbit at no cost to the participant, and once part of the program, they could have incentives for meeting their goals. Initial findings showed that 96% of employees used the program, and 77% believed it would help them reach their individual health goals. Example 2 of primary prevention for obesity is to develop worksite programs for weight loss, as adults spend much of their time at work. Companies can invest in information, education, behavioral, and social changes that can encourage and motivate employees in weight reduction. Companies can also invest in access to healthy food options on site and may provide opportunities to increase physical activity during the day, allotting time for staff to exercise, and having reward programs with local facilities such as a YMCA at discounted rates. Example 3 of primary prevention is something everyone can use today and benefit from, and that's to decrease the amount of screen time in front of a computer, TV, or phone. Support can be provided through classes aimed at skill building, goal setting, reinforcement techniques, and family support and encouragement. The ARMP and DNP can utilize leadership competencies to encourage successful weight reduction to decrease the prevalence of obesity. The competencies applicable will be discussed in the following slides. Weight loss is often very challenging for individuals. Plateaus are come across. Individuals often feel hopeless and discouraged that weight does not come off as quickly as it was put on. Transformation leadership comes into play to inspire and stimulate patients to achieve extraordinary outcomes. Employee development can empower the individual in weight loss programs. This competency could be applied to example 2 of primary prevention discussed earlier regarding worksite programs for weight loss. Motivation can encourage the individual to lose weight and be successful. This competency could be applied to example 3 of the primary prevention discussed earlier regarding decreasing screen time use and replacing it with activity. A spotlight example of primary prevention in regards to motivation is the Wise Woman program, Ladies First. This program works by motivating women after a readiness assessment is conducted to make lifestyle changes regarding weight loss. The program teamed up with Weight Watchers, making it free to members for the first 6 months. Participation in the program includes weekly weigh-in, access to meetings, cookbooks, and even assistance with transportation if needed. Relationship building forms bonds between the nurse and the individual by establishing a trusting relationship. Patients are more likely to remain encouraged, motivated, and be productive to lose weight when this competency is applied. Lastly, influence utilizes strategic perspectives of leadership and power to build up individuals to the realization of self and their ability to change poor health outcomes for the better by reducing weight, thus improving their overall health condition. So how does the ARMP or DNP know that we're succeeding in weight reduction? Other than the obvious physical changes in a person's appearance, the above is a list of some health assessment indicators or ways to measure the success of a person losing weight. Included is improvements in BMI calculations and weight reduction, decreased blood pressure, heart rate, or normal glucose, to name a few. This is an example of an action plan and is a way to measure success. It was created by Kaiser Permanente. Note to keep your goals realistic. Start by taking small steps towards your goal, and if you feel stuck or having a hard time, ask a friend, family member, or your doctor for help. This example is an evaluation of the Active Track Fitbit program, and it actually is tracked in the Fitbit app. It's easy to use, data is recorded automatically, and there are in-app challenges that are available for friendly competition and social media. Something useful about the app is the social aspect of being able to challenge your friends. Evaluations of example 2, the work site program, and example 3, the decreased screen time, are listed on this slide. Both ways to evaluate are similar, but being successful could mean creating action plans, taking before and after photos, establishing accountability partners, can all be ways to stay on track and evaluate process. In summary, obesity is a major problem afflicting the nation from early childhood to older adults. More than 1/3 of adults are either overweight or obese today. Being overweight or obese can increase the risk of chronic illnesses and diseases that often can be prevented altogether. Weight reduction by decreasing caloric intake and increasing physical activity can be a safe way to lose weight and increase health. There are many primary prevention strategies aimed at weight loss that can be selected based on what works for the individual. The Healthy People 2020 goal for nutrition and weight status is to promote health, reduce chronic disease risk through the consumption of healthful diets, and the achievement and maintenance of healthy body weights. Thank you.